You could walk around with a brain tumor without even knowing it. It's Brain Tumor Awareness Month, and in today's Your Healthy Family, I'm breaking down the signs of a brain tumor and the procedures used to treat them.
I was sitting there with my mouth open. I was in shock.
Kelly Moore is a flight attendant, wife, and mom in Naples who was diagnosed with a brain tumor in November. She tells me, looking back now, there were clues something was wrong.
There was the underlying factor that I just never did feel myself. I was really pushing myself to be happy and live my life. You know, as a mother, someone who's aging, menopause, I just thought, oh, I'm just tired from that. I'm tired from that.
But Dr. Edison Valle, a neurosurgeon at NCH Healthcare System, who removed Kelly's tumor in January, says there are other signs of a brain tumor.
Sometimes the brain gets irritated and people have seizures, headaches because you're putting a lot of pressure within a fixed cavity, speech problems, visual problems, sometimes weakness or problems with their balance.
Another symptom? Hearing loss. Dr. Valle says there are different types of brain tumors too. Kelly's was a meningioma. It was curable with an operation.
And then we just have to follow to make sure that they don't have a recurrence.
Other tumors can also be removed, but need radiation or chemo after. And some, sadly, aren't curable at all.
Brain cancer, what we call glioblastoma. But we have made advances on those in a way that we can prolong survival in a good quality of life for a long time.
Dr. Valle says using a specific type of MRI, they're able to create a 3D GPS of a patient's brain and tumor.
We're basically doing personalized brain surgery these days.
Using that map of the patient's brain, Dr. Valle says they can tell where your different centers are, for vision or memory, for example. And each person's brain map looks different.
Then we basically customize surgery for you so we have the least amount of risk to successfully remove the tumor and provide the best outcome that you have.
This technology allows doctors to better answer questions about how long a patient will be in the hospital, how long it will take to recover, and when they can return to work and regular activities. And of course, it saves lives.
There's nothing that's more gratifying than having somebody coming and shaking your hand and saying, thank you, you've changed my life, you gave me my life back.
I have a new lease on life. It's kind of a cliche, but it really is, it's true.
Brain tumors can also be genetic, in which case family members are encouraged to get early screenings. With today's Your Healthy Family, I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.